Dr. Zohaib, can you please upload your presentation so that we can start?
Um, So, sir, starting from where we last left. So,
So
starting
just,
from
just
distal.
so, so just
Sorry.
just wait a couple of minutes.
Okay,
Uh,
sure, sir.
so let me do a brief introduction again. I welcome you all to another session of the Resident Corner module. These sessions are arranged by the Department of Neurosurgery at Liaquat National Hospital. Today we'll be presenting the remaining part of the anterior cerebral artery. Dr. Zohaib will be discussing the post-communicating segment. This will be a very brief presentation since we already discussed the ACA in the previous session as well. So Dr. Zohaib, please start your presentation.
Thank you, sir. So, starting from distal part, posterior communicating. So, it consists of A2, 3, 4, and A5 segment. So, A2 segment, infracallosal segment, begins at ACOM, anterior communicating artery, passes anterior to lamina terminalis, terminates at the junction of rostrum and genu of the corpus callosum. A3, that is called the precallosal segment, extends around the genu of corpus callosum, terminates where the artery turns sharply posteriorly above the genu. A4 supracallosal and A5 postcallosal segments located above the corpus callosum, separated by a point bisected in the lateral view behind the coronal suture. Ascending A2, so there are two basically ascending segments. These are A2 and A3, while the horizontal segments are A5 and A4 and 5, which basically runs along the corpus callosum. So here you can see the A2 segment when it runs above and anterior to the genu, that's called the A3. When it turns sharply, that basically forms the A4 and A5 segment. After basically A4 goes into this paracentral turns and runs into the paracentral lobule. Sorry, that's A5 basically, and that's going behind the along the corpus callosum is the A4 segment. So here it's the anterior view. Both the cerebral hemispheres have been retracted, showing us the genu of the corpus callosum, A3 running superiorly in front of the genu, while A4 running along the corpus callosum. Pericallosal arteries. Anterior cerebral distal to anterior communicating artery around the corpus callosum. There are two definitions basically. Artery initial one is the anterior cerebral distal to the acom around the corpus callosum. That is the one of the main definitions. That the other is basically artery formed by the bifurcation near the genu of the corpus callosum into the pericallosal and callosum marginal arteries. But usually the callosum marginal arteries variable site varies on from the site of the origin and is nearly absent in 20% of the hemispheres. So here you can visualize the pericallosal artery starting from the A2 segment, running and forming to the A3. And here it is basically running in front is the callosum marginal artery into the cingulate sulcus. So here is the schematic diagram. There is no callosum marginal artery here. Single ACA showing the its cortical branches. It's running, forming the A2, A3 segment, running along the this horizontal segment is the A4 and A5 segment, giving up the posterior internal frontal arteries, anterior internal frontal arteries, median internal frontal arteries, and further branches which are further described ahead. So, callosal marginal artery. It is the largest branch of pericallosal artery, courses in or near the cingulate sulcus, follows a course parallel to that of the pericallosal artery. Two or more major cortical branches ascend to the medial surface of the hemisphere or to the lateral convexity of approx 2 centimeter. Its origin varies distal to the acom or at the level of the genu, or most frequent origin from the A3. So here you can see the medial dissection. Here basically the genu, from in front of it is arising pericallosal artery. Here on the medial dissection you can see the pericallosal artery arising from the acom artery, but here you can visualize the callosal marginal artery immediately arising from the anterior cerebral artery after the A2 and running into its designated sulcus. It is further being cleared in this view diagram. Is this diagram? You can see the callosal marginal artery immediately arising from the anterior cerebral artery. So here's the schematic diagram of the anterior cerebral artery. Here you can visualize its cortical branches being given off. So here's the in this diagram you can visualize the anterior cerebral artery giving the anterior communicating artery, and from there you can visualize callosal marginal artery being given in front. Distal ACA branches. These are two basal perforating branches and cerebral branches divided into cortical and subcortical branches. Basal perforating branches. A2 segment gives 4 to 5 ranges between 0 to 10 basal perforating branches that supply anterior hypothalamus, septum pellucidum, medial portion of anterior commissure, pillars of fornix, and anterior inferior part of the striatum. May arise from a pericallosal artery that originates from A2 and passes upward between the A2 segment and lamina terminalis towards the genu of the corpus callosum. So here you can see the cerebral hemispheres are being retracted. So pericallosal artery is being given. Here you can see the pericallosal artery with its basal branches given to the uh, adjacent brain parenchyma. Here it's being further dissected, showing the uh, pericallosal artery running into the uh, adjacent brain parenchyma and uh, into the adjacent lobe. Sorry. Cortical branches. Medial surface frontal pole to the parietal pole where they intermingle with the branches of posterior communicating artery. Basal surface, medial part of the orbital gyri. Cortical branches are supplied to the basal surface, which include medial part of the orbital gyri, gyrus rectus, olfactory bulb, and tract. On the lateral surface, they supply superior frontal gyrus, superior part of precentral, central, and postcentral gyrus. So here you can see the basically ACA running underneath the venous system, sagittal sinus. Underneath the sagittal sinus, you can see the uh, ACA running. So here you can visualize the slightly retracted cerebral hemispheres, where you can see the ACA running along the length of the A4 and F segment running along the length of the corpus callosum. It's the anterior view. Here is the genu. Here you can visualize the ACA running along with the cortical branches to the adjacent brain parenchyma. So it has following branches: orbitofrontal, frontopolar, anterior internal frontal, middle internal frontal, posterior internal frontal, paracentral, superior parietal arteries, and inferior parietal arteries. So here you can visualize, as seen earlier in the diagram. Here you can see the arteries cortical branches being given off. So here you can see the polar artery, anterior, middle, internal, and posterior interfrontal artery. So here you can see the diagram, basically area being supplied with internal frontal and callosal-marginal arteries. So here you can see the brown or red area basically being supplied with middle internal frontal, anterior internal frontal, posterior interfrontal arteries, while the area frontal is supplied with callosal-marginal branches of frontopolar and orbital frontal artery. Here you can see the medial surface where basically the adjacent ACA supplies the uh, parietal, frontoparietal area regions of the medial surface of the hemisphere on the both surfaces, while slightly in the other diagram you can while slightly extended to cuneus and precuneus area on the right side, and while on the left side it's limited behind in front to the limited in front to the central sulcus. So, frontopolar and orbitofrontal arteries present in nearly all hemisphere, and least frequent branch is the inferior parietal artery that is present in approx two-thirds of hemispheres. ACA segment of the origin of cortical branches, orbitofrontal and frontopolar arteries A2, while anterior and middle internal frontal and callosal-marginal arteries arises from the A3 segment. Paracentral artery arises from the A4 segment, while superior and inferior parietal arteries arises from the A5 segment. Posterior internal frontal artery may arise from the A3 and A4 segment or callosal-marginal artery. Orbitofrontal. So it is the first cortical branch of distal ACA. Origin is from the A2, uncommonly common trunk with frontopolar artery, or from the A1 segment, passes down and forward toward the floor of the anterior cranial fossa to reach the level of plenum sphenoid. Supplies the gyrus rectus, olfactory bulb, tract, and medial part of the orbital surface of the frontal lobe. Frontopolar artery, it origins from the pericallosal artery in 90%, while callosal-marginal artery in 10%. Passes anteriorly along the medial surface of the hemisphere towards the frontal pole. Supplies the medial and lateral surface of the frontal pole. Internal frontal arteries supplies the medial and lateral surfaces of the superior frontal gyrus. Origin arises from the A3 segment of the pericallosal artery or from the callosal-marginal artery combined. Anterior internal frontal artery origins from the origin at or inferior to the level of the genu of the corpus callosum. Middle frontal artery courses posteriorly in the cingulate sulcus at a short distance. Posterior internal frontal artery courses upward to the cingulate sulcus, then backward for a short distance before turning superiorly to terminate in the uppermost limit of the paracentral fissure. Paracentral artery arises from the A4 or callosal-marginal artery approximately midway between the genu and splena of corpus callosum. Supplies the portion of premotor, motor, and somatosensory areas. While parietal artery, superior parietal artery arises from the A4, 5 or callosal-marginal segment, supplies the superior portion of precuneus courses in the marginal limb of cingulate sulcus. Inferior parietal artery arises from the A5, supplies the posterior inferior part of the precuneus, adjacent portions of the cuneus, and it is least frequent cortical branch of the AC. Callosal branches. Pericallosal artery starts from the rostrum, supplies basically rostrum, genu, body, and splenium, joined posteriorly by the splenial branches of the posterior communicating artery.
PCA is posterior cerebral
Sorry,
artery.
PCL, posterior cerebral artery. Every 7 short callosal branches also supply septum pellucidum, anterior pillars of fornix, and part of the anterior commissure. In few cases, long callosal arteries arising from the pericallosal arteries. Here's the diagram basically, where we can visualize the branches and medial dissection is being done on, where you can see the basically A2 running, and in front it forms the A3, while uh, turning back sharply, it forms the A4 and A3 segments. Here you can see the A4 segment running into this paracenter into the sulcus and supplying the paracentral lobule. Here you can visualize the callosomarginal artery just forming a head in front of the A2 segment running, and while the A3 segment running into the adjacent cingulate sulcus. Sir,
Did you incorporate any NGOs in this presentation?
and use no, sir.
So thank you, Dr. Zohaib, for this presentation. This was about the post-communicating part, and it would have been nice if you would have added some NGOs showing the anatomy. Um, I'm sorry that this was a very brief session since we already continued ACA last week as well. And we'll be continuing with the vascular anatomy next week as well. And we'll most probably will be covering middle cerebral artery. If there's any questions, you can use the chat box. If not, then uh, we will conclude the session. Um, any questions from the participants sitting in the conference room? Dr. Zohaib?
No one, sir.
So if there's no question, we'll conclude this session. Thank you, Dr. Zohaib, for this presentation. And for all the future presenters, I suggest that you involve angios because that's where you study the vascular anatomy the most and incorporate with what you see in the pictures from the roton. We'll see you all next week. Thank you, everyone. Let's